Hi, I am so elated to meet you in the program of 3 p.m. 3-point medics. We have been learning about hyponatremia in very detail. The last few sessions have addressed the causes of hyponatremia and in fact how to evaluate hyponatremia to some extent. Just I want you to recall once again, when you find hyponatremia, always the first investigation that should be ordered is serum osmolality. Since serum osmolality is determined by sodium alone, almost 90% of serum osmolality or serum solute load is determined by sodium. So, when you have hyponatremia, we always expect decreased serum osmolality, I mean less than 275 milliosmolality per kg. So, when you have decreased serum osmolality, then you are able to exclude the false causes or pseudo hyponatremia, including hyperproteinemia and hyperlipidemia in the blood, or when patient has received mannitol and when they are flooded with hyperglycemia and glycine administration and even radio contrast administration. These are the causes can produce hyponatremia, but there will be normal serum osmolality or there will be increased serum osmolality. But when you have hyponatremia, if you think that you are dealing with true hyponatremia, there should be decreased serum osmolality. So, when you find hyponatremia, order serum osmolality. If serum osmolality is less than 275 milliosmolality per kg, that means you are dealing with true hyponatremia or otherwise called hypotonic hyponatremia. Then the most important game changer investigation for evaluation of hyponatremia is urine osmolality. Why I mentioned game changer? Because by means of doing urine osmolality, out of 15 causes of hyponatremia, only 3 causes of hyponatremia is able to have reduction in urine osmolality less than 100. So, when you do urine osmolality, we always try to find out whether urine osmolality is less than 100 or more than 100. If urine osmolality less than 100, only 3 causes. One, beer potomania, and second one, tea and toast syndrome, and third one, inappropriate IV fluid administration, especially hypotonic solution, including 5% dextrose and 0.45% normal saline or otherwise called off normal saline. So, these 3 causes, even though they are very rare, but when urine osmolality is more than 100, you can comfortably rule out these 3 causes. Okay. Even though these causes are rare, 3 months before we received one patient referred from a hospital for management of altered sensorium. So, we evaluated in detail. We found out serum sodium is 117. So, we are sure that this hyponatremia was responsible for his altered sensorium. The patient was on 3rd post-op day, just 3 days before patient underwent appendicectomy. So, in the 3rd day, he developed altered sensorium for which he was transferred to us. Serum sodium was around 117. The first step was to do serum osmolality. We did serum osmolality. That revealed only 251 milliosmolality per kg against normal value of 275. So, now we are sure that we are dealing with true hyponatremia. We ruled out all kind of hyperlipidemia, hyperparathinemia, everything so on. So, now we are dealing with true hyponatremia, 251 milliosmolality per kg. Now, we ordered game changer investigation, that is urine osmolality. So, by doing urine osmolality, if urine osmolality less than 100, 3 causes, more than 100, 12 causes are there. So, we were very eager to do urine osmolality. We did urine osmolality that revealed only 70 milliosmolality per kg. As I told you earlier, we are very eager to see whether urine osmolality is less than 100 or more than 100. Here urine osmolality is 70. Only 3 differential diagnoses, beer potomania or otherwise who rely on simply beer as a diet, not taking any protein rich diet, and second one, tea and toast syndrome. They will keep on taking tea and toast, especially in elder individual, they will have poor access to nutrition rich diet. And third one, inappropriate IV fluid administration, including 5% dextrose and half normal saline. So in this patient, urine osmolality is only 70. So it evoked only these 3 differential diagnoses. Then we inquired the history. The patient didn't have any history of alcohol consumption ever in his life. And second one, he lives in the family. He had good access to good nutrition rich diet. So T-toast syndrome was ruled out. And third one, patient had been receiving IV fluid for past 2 days in post-op status. Then we scrutinized the IV fluid status. Patient received in 2 days totally around 4 liters of 5% dextrose, which is an hypotonic solution. So it has diluted his sodium level. So we found out this patient had hyponatremia secondary to administration of hypotonic solution, that is 5% dextrose administration. This is how this urine osmolality would be very useful. But if urine osmolality is more than 100, you can rule out 3 causes. Then rest of these 12 causes have to be explored. Then another third investigation after ordering serum osmolality and urine osmolality, then you have to make one more investigation, that's called urine spot sodium. What is the importance of urine spot sodium? So if urine spot sodium is less than 40, it has few causes. More than 40 milliequivalent per liter, it has few causes. So if urine spot sodium is less than 40 means kidney is avidly absorbing sodium, okay, from the tubular filtrate. That means when you lost sodium from the source other than kidney, for example, from the GI tract by means of diarrhea and vomiting, so kidney will try to compensate your hyponatremia that has been lost through the GI tract by means of absorbing sodium from the glomerular filtrate. So what happens? Your urine spot sodium will be less. When you have hyponatremia due to excessive sweating, so kidney will try to compensate hyponatremia by avidly absorbing sodium. So you will have urine spot sodium less than 40. When you have hyponatremia by means of intestinal obstruction or pancreatitis or burns or some kind of third space loss, so this normal aggressive kidney will try to absorb all the sodium that is supposed to be excreted in the urine, that will be completely absorbed. So your urine spot sodium will be less. So when you do urine spot sodium, when urine spot sodium is less than 40, then it indicates your kidney is absorbing sodium very aggressively to compensate sodium lost anywhere in the body. So namely the causes would be from the GI tract, diarrhea and vomiting and burns and sweating and intestinal obstruction and so on. And moreover, when urine spot sodium is 40 milliequivalent means when kidney is absorbing sodium means you can rule out sodium loss in the urine as the cause for hyponatremia. These are the 2 important things that can be conveyed from urine spot sodium. When you do urine spot sodium, try to find out is it less than 40 or more than 40. Less than 40 means kidney is absorbing sodium to compensate hyponatremia that is induced by some other source in our body. When it is urine spot sodium is more than 40 means sodium itself is lost from the kidney, which is responsible hyponatremia in his body. So we will see the causes of urine spot sodium more than 40, I mean the causes for sodium loss in the urine in next session. Thank you.